Welcome to an Edge Factor virtual workplace experience. Today, Sarah, the president of Home Assist, will be taking us around their facility while giving us an inside look at what they do. We'll be looking at the following chapters. Chapter 1, an overview of Home Assist. Chapter 2, careers and training. Chapter 3, skills and certifications. And finally, Chapter 4, CPR and emergency skills. Let's get started.
Hi, welcome. My name is Sarah Wilson and I am President and CEO for Home Assist Health. Welcome to our home. Here at Home Assist Health, we provide critical non-medical services in the home, and we are an essential part of the healthcare continuum that many people don't even know about. Our services go into the homes of individuals living with complications of disabilities, aging, individuals who are learning how to gain control over their chronic conditions, or have a safe transition through hospital stay and returning home, or even children who are learning how to live safely with a disability, even autism. Our services are here to provide you a platform to pursue careers in medical fields and social work, and in some cases, education. We employ a fabulous amount of direct care workers. These are individuals that are going into the homes of people that need our home care services so they have a healthy, strong, independent life. What these services look like can include anything from skill building and education to personal care, errands, companionship, and they really are essential to promote a healthful, independent lifestyle. When you think about healthcare, you're usually thinking about a doctor's office, a hospital, even some therapy units. But when we're talking about home care, we're talking about a part of healthcare that happens at home. And it's one of the most important, discrete parts of healthcare. Think about a time when you just felt really bad, or you had a loved one who was older and it was really challenging for them to get around and do their own personal cares. Well, that's where home care comes in. Our skilled professionals go into the homes of anybody that lives in the community to help them with their personal care needs, their health care needs, even navigation and accessing community environments and family events. Home care is a vital preventative part of healthcare. And many don't even know that time and time again, home care has proven to improve health outcomes, to improve life satisfaction, all while reducing emergency department visits and readmission rates. Home care is one of the most important elements of the healthcare continuum that many don't even know about today. In fact, home care is not only one of the most in-demand services, it's one of the fastest growing industries today. So if you're thinking that you might be interested in a career in healthcare or in public health or education, home care is the best place to start to really get hands-on experience to know who it is that I want to be in my career. In home care, there's various career tracks you can take. One of the most important is training and education. What you see here happening is our caregivers getting hands-on experience and training for certification to be a skilled, talented direct care professional. These skills are critical in making sure that people are safe when receiving care at home and that they have longevity at home. Training is vital, and so we are proud of our training program here and glad that we are able to share it. There are other career tracks in home care. Everything from the direct care professionals that we've talked about, the caregivers themselves, but we also look at careers in education, and we talk about careers in IT. So much has gone into medical information and technology systems, including technology systems at home. We also employ a wonderful team of human resources, payroll, billing, so finance, careers in healthcare and home care is only growing. But we also have critical needs for operations, quality assurance, and compliance. Home care is a place for anybody seeking professional tracks that help and strengthen communities one person at a time. In home care, we have an array of different career paths, from training and education to IT, finance, and operations. But they all come together for one purpose, and that is to provide a quality in-home program staffed with talented direct care workers, those who we call our caregivers, where they are providing essential non-medical services to our individuals in their homes and within our community. So what does it mean when we talk about skills training for home care? And why is certification so important? Well, think about it. You're working as a caregiver one-on-one with a patient or an individual with complex health needs, sometimes disabilities. It is incredibly important that you as a caregiver have the training, the techniques, and the equipment and the know-how to use it so that everybody is safe, the person you're serving as well as yourself. We take training very seriously in home care, and when our staff get the training they need, they're able to serve in almost every environment. When you train to be a caregiver, you're gaining certifications in CPR, first aid, training certifications as a direct care worker, and in some cases a direct support professional. These are tangible certifications that you can take along through your career pathway and prepares you for whatever career ladder you're pursuing. So with the training that you get in home care work as a caregiver, you can use this in your personal life. You can use it with the patients that you're serving and use it to build your career in certain pathways that you choose. But what's most important is it provides a safe, high-quality experience for the person you're serving and has proven health improvement outcomes, including quality. We have found people are happier, more satisfied, and live longer lives when they're at home with their belongings, their pets, and with their families. So the skills that you learn here help you to create stronger communities, one person at a time. So you hope it never happens to you, but you might find yourself in an emergency medical situation, and it's important that you know CPR. That's what we do here. We teach caregivers how to have safe CPR skills. Tanner,
yes.
If I may interrupt you, and please watch this demonstration of how to do CPR.
Sure thing. So whenever we're doing CPR, we are making sure the person is not making sure that they're non-responsive, but we're checking for their responsiveness, right? So if they're non-responsive, you're going to initiate CPR. Always when you start CPR, you want to have someone call 911, and we want to make sure someone's getting an AED. That is our first priority. But once you have asked someone to call 911, you're good to start CPR. To do CPR, I'm going to use the heel of my hand, and that goes right in the middle of the rib cage below the clavicle, and I'm going to do 30 chest compressions like this. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, and 30. Once you have done 30 compressions, you will do 2 rescue breaths. You got to put your hand on the forehead, plug the nose, lift the chin like that to clear the airway. Then I would seal his mouth with my mouth, and I would give 2 breaths until his chest is inflated, and then I could put his head back down, and I would start with the compressions all over again. And you repeat this cycle over and over until you either get an AED or you get an ambulance there to help revive the person.
Thank you, Tanner. So as you can see, direct care workers are skilled in saving lives in emergency situations. Our caregivers are truly home care heroes. They are ready to support and protect vulnerable adults and children at a moment's notice. So if you have it within you to be a compassionate person, somebody who puts compassion into action, maybe caregiving is a career for you.